In this podcast episode, Dr. Chris Palmer discusses the impact of alcohol, marijuana, and other mitochondrial poisons on mental health. He emphasizes the importance of addressing lifestyle factors such as diet, exercise, sleep, stress management, and relationships to improve mental and metabolic health. Dr. Palmer explains that substances like alcohol, marijuana, and ultra-processed foods can act as mitochondrial poisons, affecting mitochondrial function and overall health. These substances can lead to insulin resistance, poor metabolic health, and mental health issues. He highlights the need to limit and reduce the intake of these substances to improve overall well-being. Dr. Palmer emphasizes the importance of basic lifestyle interventions, including diet, exercise, sleep, stress reduction, and relationships, in optimizing mental and metabolic health. He suggests starting with real food, avoiding ultra-processed foods, and maintaining stable blood sugar levels to support mitochondrial function and overall health. Dr. Palmer discusses the benefits of strength training and Zone 2 cardio for improving mitochondrial health. He suggests incorporating moderate to high-intensity exercise, such as strength training and cardio, into a regular routine to support muscle growth, mitochondrial function, and overall health. Dr. Palmer explains that both alcohol and marijuana act as mitochondrial toxins, impacting neurotransmitter systems and cellular function. Excessive use of these substances can lead to a range of physical and mental health conditions, including brain shrinkage and neuropsychiatric disorders. He expresses concern about the increasing use of marijuana, especially among young people, and the potential long-term effects on mental health. Dr. Palmer acknowledges the therapeutic benefits of marijuana for some individuals, but warns against the long-term consequences of regular use. He highlights the trend of breeding marijuana strains with higher THC levels and lower CBD levels, which can have detrimental effects on mitochondrial function and brain health. He cautions against the suppression of brain function and mitochondrial function through excessive substance use. Dr. Palmer underscores the urgency of addressing the growing mental health epidemic by understanding the underlying metabolic factors contributing to mental disorders. He advocates for better solutions and interventions to prevent and treat mental illnesses, emphasizing the importance of lifestyle factors in optimizing mental and metabolic health. Dr. Palmer highlights the potential risks associated with regular marijuana use, emphasizing that individuals who smoke marijuana are 4 times more likely to develop schizophrenia. While this risk is still relatively low in the general population, the consequences of developing schizophrenia or other mental health disorders can be severe and life-altering. The conversation delves into the concept of brain energy theory, which suggests that mitochondrial function plays a crucial role in mental health. Dr. Palmer discusses cases where individuals have shown improvement in their mental health by following lifestyle changes that support mitochondrial function. He emphasizes the role of education, support, and knowledgeable clinicians in guiding individuals towards recovery from mental health disorders. The discussion also touches upon the use of GLP-1 receptor agonists, a class of medications that have shown potential benefits in weight loss and metabolic health. Dr. Palmer acknowledges the controversy surrounding these medications and emphasizes the importance of incorporating lifestyle factors such as diet, exercise, and sleep in conjunction with medication use. He shares insights on the potential benefits of GLP-1 receptor agonists in treating addiction and mental health disorders, highlighting ongoing clinical trials in these areas. Dr. Palmer addresses concerns about the use of GLP-1 receptor agonists in children and emphasizes the need for a comprehensive approach that prioritizes healthy lifestyle habits. He cautions against relying solely on medication without addressing underlying dietary and lifestyle factors that contribute to poor health outcomes. He advocates for a balanced approach that considers the individual's unique circumstances and needs while also promoting overall human health through a combination of interventions. The conversation also explores the societal impact of promoting healthy habits, citing the example of Japan's proactive measures to address rising obesity rates. Dr. Palmer underscores the importance of collective will and policy changes in creating environments that support healthy choices and prevent the escalation of health issues. He highlights the role of education, support systems, and community initiatives in fostering positive health outcomes for individuals and society as a whole. Dr. Palmer highlights the significant impact of diet on mental health, pointing out that what we eat can affect our brain function, even from a young age. He discusses the importance of providing children with the right food and education to support their mental health and overall well-being. He also mentions initiatives like Eat Real and the Shaw Family Foundation, which focus on improving school lunches and promoting whole foods to support children's health. Despite the clear connection between diet and mental health, Dr. Palmer notes that many mental health professionals do not prioritize nutrition or lifestyle factors in their treatment approach. He highlights the skepticism within the mental health field regarding the impact of diet on mental disorders, emphasizing the need for a more nuanced understanding of how food can influence inflammation, brain function, and overall mental well-being. Dr. Palmer discusses the challenges faced by individuals with mental illness, including the limited access to quality mental health care, stigma, and discrimination. He also addresses the troubling trend of individuals, particularly in countries like the Netherlands and the UK, seeking assisted suicide as a result of severe mental health issues. He expresses concern about the normalization of assisted dying for mental illness and the lack of emphasis on providing effective treatments and support for those struggling with mental disorders. Despite the challenges, Dr. Palmer remains hopeful about the potential for individuals with mental illness to improve their condition through innovative treatments like ketogenic diet therapy, transcranial magnetic stimulation, ketamine, and psychedelics. He shares success stories of individuals who have experienced significant improvements in their mental health through these interventions, emphasizing the importance of fighting for better mental health care and support for those in need. Dr. Palmer calls for a collective effort to build a movement for better mental health care, urging individuals to advocate for improved resources, political will, and research in the field of mental health. He emphasizes the need for a societal shift towards prioritizing mental health and supporting those with mental illness through education, awareness, and effective treatments. He encourages people to join the movement and speak out against the current challenges and limitations in mental health care.